Welcome to Lux Scout Psychology. Anxiety. It's a word we hear often, a feeling we all experience. But what happens when anxiety becomes more than a fleeting emotion? Millions around the world grapple with this reality every day. Anxiety disorders are not a sign of weakness, but a real and treatable medical condition. They are the silent epidemic, often misunderstood and stigmatized. Anxiety disorders affect people from all walks of life, regardless of age, background, or profession. Despite their prevalence, anxiety disorders often remain hidden, shrouded in shame and misunderstanding. Many individuals suffer in silence, afraid to seek help or admit their struggles. It's time to break the silence, to shed light on this often invisible epidemic. The impact of anxiety disorders extends far beyond the individual. It ripples outward, affecting families, workplaces, and societies as a whole. Untreated anxiety disorders place a significant burden on healthcare systems globally. They contribute to lost productivity, increased healthcare costs, and decreased quality of life for millions. The World Health Organization recognizes anxiety disorders as the most common mental health challenge worldwide. The numbers are staggering, painting a stark picture of the global burden these disorders carry. In the United States alone, nearly 1 in 5 adults experience an anxiety disorder each year. These figures underscore the urgent need for increased awareness, early intervention, and accessible treatment options. The good news is that anxiety disorders are highly treatable. With proper diagnosis and support, individuals can manage their symptoms and lead fulfilling lives. By understanding the different types of anxiety disorders, their symptoms, and available treatments, we can begin to remove the stigma and empower individuals to seek help. Imagine a weight on your chest, a constant pressure that never seems to lift. This is the daily reality for millions living with generalized anxiety disorder, or GAD. It's more than just everyday worry. It's a relentless state of apprehension, a feeling of impending doom that permeates every aspect of life. Individuals with GAD experience excessive and persistent worry, often about multiple things at once. Work, finances, health, family relationships. These everyday concerns become magnified, morphing into insurmountable obstacles in the minds of those with GAD. The worry is often disproportionate to the actual situation, yet it feels all too real and uncontrollable. This constant state of worry takes a toll on both the mind and body. People with GAD may experience physical symptoms such as fatigue, muscle tension, headaches, and difficulty sleeping. While GAD casts a wide net of worry, panic disorder manifests as sudden and intense episodes of fear known as panic attacks. These attacks seem to strike out of the blue, often without any identifiable trigger. One moment life is normal, the next, a tidal wave of terror washes over, leaving the individual feeling helpless and terrified. During a panic attack, the body goes into fight or flight mode, even though there is no real danger present. The heart races, breath shortens, and chest pain may occur. Dizziness, nausea, trembling, sweating, and a feeling of unreality are also common. Many individuals experiencing a panic attack fear they are having a heart attack, losing their mind, or even dying. The unpredictable nature of panic attacks can be incredibly debilitating. Individuals living with panic disorder often develop a constant fear of having another attack, leading to avoidance behaviors. The pervasive worry that defines GAD doesn't just live in the mind, it manifests physically, impacting various bodily systems. Imagine a constant state of unease, like a low hum of anxiety that never quite disappears. This underlying tension can manifest in numerous physical symptoms, creating a vicious cycle that further exacerbates the anxiety. Muscle tension is a hallmark of GAD. The constant state of worry keeps the body in a perpetual fight or flight response, leading to tightness and pain in the muscles, particularly in the shoulders, neck, and back. This chronic tension can cause headaches, migraines, and even contribute to temporomandibular joint (TMJ) disorders. Digestive issues are also common in individuals with GAD. The gut-brain connection is powerful, and anxiety can disrupt the delicate balance of the digestive system. Social interaction is the lifeblood of human connection. We thrive on shared experiences, conversations, and relationships. But for individuals with social anxiety disorder or social phobia, these everyday interactions are a source of intense fear and dread. It's more than just shyness, it's a crippling fear of judgment and scrutiny in social situations. Imagine a spotlight shining directly on you, every eye in the room focused on your every move, every word. This is the overwhelming feeling individuals with social anxiety experience in social settings. They fear being judged, criticized, or ridiculed, even for the smallest mistake or perceived flaw. This fear can be so intense that it leads to avoidance behaviors, causing them to withdraw from social events and interactions altogether. The fear of social judgment can be so paralyzing that it significantly impacts their ability to form relationships, succeed in school or work, and engage in everyday activities. While social anxiety involves a fear of social scrutiny, specific phobias center around an intense and irrational fear of a specific object or situation. These phobias are not just dislikes or aversions, they are powerful fears that trigger immediate and overwhelming anxiety, often leading to panic attacks. The objects or situations that trigger specific phobias vary widely from person to person. Some common phobias include fear of spiders, arachnophobia, heights, acrophobia, enclosed spaces, claustrophobia, flying, aviophobia, and needles, trypanophobia. While these fears might seem irrational to others, for individuals with specific phobias, the threat feels very real and terrifying. Individuals often go to great lengths to avoid their triggers, even if it means disrupting their daily routines, missing out on opportunities, or isolating themselves from others. For example, someone with a fear of flying might avoid taking a dream job across the country, or a person with a fear of spiders might refuse to go hiking or camping. Social anxiety disorder doesn't just cast a shadow over social events, it can seep into every aspect of an individual's life, creating a pervasive sense of fear and inadequacy. The anticipation of social situations alone can be enough to trigger anxiety, leading to days, weeks, or even months of worry and dread. This constant fear of judgment can have a profound impact on a person's self-esteem and sense of self-worth. Individuals with social anxiety often develop negative self-perceptions, believing they are inadequate, uninteresting, or unworthy of connection. They might engage in excessive self-criticism, focusing on their perceived flaws and mistakes while downplaying their positive qualities. This negative self-image can lead to a self-fulfilling prophecy. The more they believe they are socially inept, the more anxious they become in social situations, further reinforcing their negative beliefs. Agoraphobia is a complex anxiety disorder that can severely restrict an individual's life. Imagine feeling trapped, your world shrinking, as you avoid more and more places out of fear. This is the reality for individuals living with agoraphobia. The fear of being trapped in situations where escape might be difficult or help unavailable. Common triggers include crowded places, public transportation, and being alone outside the home. Separation anxiety, often associated with childhood, can persist into adulthood, impacting relationships and daily life. While it's natural for children to experience distress when separated from their caregivers, separation anxiety disorder goes beyond typical childhood anxieties, manifesting as intense fear and worry about being apart from attachment figures. Imagine the feeling of dread, the overwhelming worry that washes over when a loved one leaves, even for a short period. This is the daily reality for individuals with separation anxiety disorder. They might experience extreme distress at the thought of being separated from their loved ones, fearing something terrible will happen to them or themselves while apart. Adults with separation anxiety might experience similar anxieties when separated from partners, spouses, or close family members, impacting their ability to maintain healthy relationships and routines. The impact of agoraphobia extends far beyond the physical limitations it imposes. It's like an invisible cage, trapping individuals in their homes and minds, preventing them from fully experiencing life. This isolation can have devastating consequences for their social, emotional, and occupational well-being. Imagine a life confined within the walls of your home, unable to enjoy simple pleasures like meeting friends for coffee, going to a movie, or even taking a walk in the park. This is the heartbreaking reality for many individuals with severe agoraphobia. The fear of triggering a panic attack becomes so consuming that they avoid any situation perceived as potentially anxiety-provoking. This isolation can lead to feelings of loneliness, depression, and hopelessness. Individuals with agoraphobia might withdraw from social interactions, miss out on work or educational opportunities, and experience a decline in their overall quality of life. Childhood is a time of exploration, of finding one's voice and expressing oneself freely. But for some children, anxiety renders them silent in certain social situations. This is the reality of selective mutism, a complex anxiety disorder. Imagine a child who chatters at home but becomes silent at school. This stark contrast is a hallmark of selective mutism. Breaking the silence of anxiety disorders requires a multifaceted approach that addresses the root causes, manages symptoms, and equips individuals with coping mechanisms to navigate life's challenges. Fortunately, effective treatments are available, offering hope and healing to those struggling with these often debilitating conditions. Psychotherapy, particularly cognitive behavioral therapy, CBT, has emerged as a cornerstone in treating anxiety disorders. CBT helps individuals identify and challenge negative thought patterns and replace them with more balanced and realistic ones. It equips them with practical tools and techniques to manage anxiety, cope with stressful situations, and gradually face their fears in a safe and controlled environment. Medications, such as selective serotonin reuptake inhibitors, SSRIs, and anti-anxiety medications, can also play a role in managing symptoms, particularly in cases of severe anxiety or when psychotherapy alone isn't sufficient. It's often marked by ups and downs, setbacks, and triumphs. Creating a supportive and understanding environment is crucial for individuals navigating this path, empowering them to persevere and reclaim their lives. Family and friends play a vital role in providing emotional support, encouragement, and understanding. By educating themselves about anxiety disorders, their symptoms, and treatment options, they can better understand their loved ones' struggles and provide appropriate support. Patience, empathy, and active listening are invaluable tools in fostering a sense of safety and validation. Support groups and online communities offer a safe and welcoming space for individuals with anxiety disorders to connect, share their experiences, and learn from one another. We've explored anxiety disorders, their impact, and the path to recovery. From generalized anxiety disorder to agoraphobia, these conditions affect every aspect of life. We must recognize our shared responsibility in fostering an informed and empathetic society. It begins with challenging misconceptions and fostering open conversations. Stigma thrives in silence. It festers in the shadows of misinformation and fear. We must tear down the walls of stigma to support those with anxiety disorders. This requires a concerted effort from all corners of society. Start by changing the language we use when discussing mental health. Use respectful and empowering language that affirms experiences. Challenge the notion that seeking help is a sign of weakness. Advocate for increased funding for mental health research and treatment. Ensure access to affordable and quality mental health care for all. Despite the challenges, there is always hope. Anxiety disorders are highly treatable, and with the right support and resources, individuals can overcome these challenges and live full and meaningful lives. The journey begins with taking that first, often daunting step of seeking help. This might involve reaching out to a trusted friend or family member, contacting a mental health professional, or joining a support group. Remember, you are not alone in this journey. Countless individuals have walked this path before you, and countless more are walking it alongside you. There are resources available, people who understand, and evidence-based treatments that can help you manage your anxiety and reclaim your life. Embrace the support available to you. Connect with others who understand, lean on loved ones, and seek professional guidance from qualified mental health professionals. Recovery is a process, and it might not always be easy, but with every step you take towards healing, you are moving closer to a brighter and more fulfilling future. Please like the video and share it with others. It helps those who are suffering. Thank you for watching.